name is Kelsey Wallace. I'm a nurse practitioner student at Francis Marion University, and today I'll be going over pressure ulcers. So, on this first page, I got some objectives for this PowerPoint. First, we're going to define what a pressure ulcer is and go over the stages. We're going to go over some risk factors as well as some diagnostic tools and tests that are used to diagnose pressure injuries. We're going to also go over some pharmacological and non-pharmacological treatment options. And then lastly, we're going to go over the relevance of pressure injuries and APRN's treatments in the elderly population. So first, what is a pressure ulcer? It is defined as localized skin and or soft tissue damage that usually occur over a bony prominence. It happens as a result of intense, prolonged pressure or pressure in combination with shear. These injuries can present as intact skin or open ulcers, and there are four stages of pressure ulcers. The NPIAP is commonly used to diagnose the different stages of pressure ulcers. Down at the bottom, I have the different stages of pressure ulcers, as well as a short description of which each stage is like. And then over to the right, I have a picture of what the different stages look like. So on this slide, I listed some risk factors. So we typically see pressure ulcers in our immobile patients, in our patients who might have suffered from a spinal cord injury, our incontinence patients, and our diabetic patients, and especially in our geriatric and fragile patients. We can attribute this to reduced perfusion and sensory loss, so it is important to educate these patients and closely monitor them for any early signs of pressure injuries. Over to the left, I have some common sites where pressure injuries occur. So on this slide, I got some commonly used diagnostic tools and tests that are used when diagnosing a pressure ulcer. So it's common to identify any bacteria that might be growing inside the wound. You can do this with a wound culture and sensitivity. You want to also evaluate the patient's nutritional status, focusing on the total protein, albumin, and prealbumin. These are typically going to be decreased in those patients who might have inadequate nutrition. You can do a CBC as well, focusing on the lymphocytes and leukocytes. So typically in our malnourished patients, you'll have a decrease in lymphocytes. And then in our patients who might have an infection and active inflammation, you'll have an increase in leukocytes. You could also do a SED rate and then the Braden scale and Norton scale. These are two assessment tools that are used to assess patients' risk for developing a pressure ulcer. So, there are pharmacological and non pharmacological treatments for pressure ulcers. After doing the culture and sensitivity, if there's any bacteria that's identified, we want to make sure these patients are started on the appropriate antibiotics. In those with pressure ulcers, we want to optimize nutrition. So, we want to encourage a high calorie, high protein diet. If they're unable to tolerate PO intake, they may need to be hospitalized for enteral or peri-enteral nutrition to correct any deficiencies. All patients should be educated on proper turning, positioning, and support to minimize tissue pressure and damage. And in those with pressure ulcers, it can be very painful. So we want to make sure that we are properly treating their pain. In those with stage one pressure ulcers, they do recommend non opioid pain medications, but in later stages and in those who complain of moderate to severe pain, opioids may be needed. We also want to promote healing. So, in stage one, we want to make sure that area is covered and protected. And in later stages, they may need to get that wound debrided of necrotic tissues and have the appropriate dressing and packing. The APRN role in promoting quality patient care for elderly patients is important. Often, support from the interdisciplinary team is needed to ensure all goals of care is properly addressed. This includes a provider, nutritionist, PT, dietitians, pharmacists, and wound care. Informatics can be used to predict, track, and evaluate pressure ulcers. As I stated earlier, the Braid scale can be used to analyze patient data to assess their risk for skin breakdown. Pressure ulcers can be very expensive. It costs the U.S. healthcare system millions of dollars yearly. Providers must ensure that they are educating patients to avoid unwanted expenses, burdens, and litigation costs. The role of ethical decision making in order to provide patient centered care involves tailoring patients' treatments and allowing autonomy for patients with pressure related injury. And then lastly, it is important to make sure that we have cultural competence. This leads to better patient outcomes, improved treatment adherence, and it strengthens the trust between patients and diverse populations.